Might call Will, are you good?
Yeah, go ahead.
Oh, hey, it's Rich. I meant to call Steph in the booth. Will you just tell the booth that this shot is up and they're probably 2 minutes away from Paige? Thank you, appreciate you. We'll be in June to call Matt or Steph in the booth. Uh-huh.
Good morning. Yesterday, a critical step was taken to help get us past this pandemic. The CDC recommended COVID-19 vaccines for children ages 5 to 11, and this is great news. Another moment of promise in this long road to recovery. As Dr. Rochelle Walensky, director of the CDC, said last night, with science leading the charge, we have taken another important step forward in our nation's fight against the virus. The timing comes as cases here and across the country dip while anxiety rises. With colder weather approaching, indoor holiday gatherings are planned, increasing the risk of infection. President Biden's administration has authorized a shipment of 15 million of the child-sized doses across the country so that pediatric offices and public health departments can begin offering the shots as early as this week. The CDC approval eases the worries of parents and will help keep our kids in the classroom and provide another layer of protection for our teachers. Our children are where we are seeing the greatest community spread. Being able to provide vaccinations for our children ages 5 to 11 will have a significant impact on slowing the virus. Families want to gather safely for the holidays, and these vaccines will make that possible. With these child-sized vaccines, we'll be able to say with confidence, Happy New Year. The CDC's approval and the Department of Public Health is ready to administer the shots for our kids beginning Saturday at the John C. Murphy Health Center in Berkeley and at the Rock Road branch of the St. Louis County Library, the start of our comprehensive vaccine program. Next week, the vaccines will continue at all 3 Department of Public Health Centers locations and at 4 library branches. And here are some of those details. The Saturday clinics at John C. Murphy Health Center will be held throughout November from 10 a.m. to 3 p.m. We'll hold evening hours until 7 p.m. at the South County Health Center in Sunset Hills on Tuesdays and Thursdays through November 23rd. The regular hours at all of our clinics are 8 a.m. to 5 p.m. And our libraries have been great partners throughout the pandemic, and 4 branches will provide vaccines for our children ages 5 to 11. At the Lewis and Clark branch, the vaccines will be available from 1 to 7 p.m. on Wednesdays. At the Natural Bridge branch, the vaccines will be offered on Thursday from 1 to 7 p.m. The Florissant Valley branch will offer children's vaccines on Fridays from 9 a.m. to 4 p.m. And the Rock Road location Vaccines will be available on Saturdays from 9 a.m. to 4 p.m. We'll get all of this information posted on our revivestl.com website, and we'll share today on our social media websites and channels through our county government. Appointments are recommended for the library events, so we want to make sure that we have enough vaccine at all of these locations. However, walk-ins will still be welcome. As I mentioned Monday, St. Louis County has also partnered with a dozen pediatric care providers to supply their patients with vaccine, and will continue to do so for pediatric doses as long as we have supply. We're also working with school districts to provide some on-site access at schools as well. And all of those details, as they become available, will be widely distributed throughout county government and all of our social media channels. This is a moment of relief, and most of our parents in an understandable moment of anxiety for some. We all want our children to be safe, we want them out of danger, and we want them to have a promising future. We want them to have memories in school that so many of us cherish, and we want them to be able to stop wearing masks and to no longer worry about getting sick or passing the virus on to someone else. Parents who have not yet been vaccinated can get a shot at the same time you bring your child to an event. We have a patient services line to support parents and guardians with questions about vaccinating their children. And that number is 314-615-7967. That's 314-615-7967. The Department of Public Health is planning a virtual town hall to field questions on vaccines with the new doses for children. We don't anticipate setting up any mass vaccination sites right now, and we believe that our partnerships with pediatricians, libraries, and schools will provide more access and more opportunities. However, if we need more capacity, we're ready to quickly expand and to accommodate the demand for the 5 to 11 age group and the continued interest for booster shots. This is another moment to work together to show the rest of the state and the country that we all want the same thing: a safe community for our children, protected from harm. Thank you, and I'd be happy to take any questions.
Dr. Bain, what is your message to moms and dads who might be a little reticent, anxious about getting their children vaccinated? What's the key for them to understand in your mind here going forward?
So the question is, what is the message for parents who are anxious about the vaccine? The vaccine is safe, and it's effective, and it's our path forward out of this pandemic. The cases are rising the most among kids, especially kids under 12 who have, as of today, not yet been able to get vaccinated. So we know this vaccine is safe. We know that it's effective. We know it's the way out of the pandemic, and we know it's the path back to normal for kids and for the rest of our community, too. If parents do have questions, they should talk to their pediatricians about any particular medical conditions that their children may have, that they're worried about the vaccine. But we've got plenty of data now that we know this vaccine is safe and effective.
Have you talked with school districts about setting up clinics at school? And I know at least one in the area and others are talking about setting up vaccination clinics directly on campuses. Your thought there for these programs to go into schools?
So the question is about what sort of activity regarding vaccinations we'll see at schools. And each school will have their own plan. Some of them are partnering with St. Louis County Department of Public Health. Some of them are partnering with other health systems. Some are partnering with their own provider network that they've set up. But each school will have their own plan. We're talking to them, the ones that need our help. We will help. We've had great partnerships with our schools since the beginning of this pandemic. Communication lines are wide open, and we share resources, information, and opportunity as much as we need to.
How substantial do you think this is going to be toward getting us to the end of the pandemic? I mean, is this a substantial development in your mind, or where do you go big picture with this?
Well, this is a large part of our population, kids under 12, a large part of our population that could not be vaccinated until now. So this gap has to be closed. This has to be closed to end the pandemic, and this vaccination gap has to be closed to get our kids back to normal in school. This is an extraordinary development. It's a significant development. It's what we've been waiting for, and this is a very important step forward for us just in time for the holidays.
Any other questions? Thanks, everyone.
Okay, thank you.